Hello, this is Erica. We're going to be doing my assessment video today on the heart and lungs. First, we're going to pan the room. Sydney. And I have absolutely no notes. Full circle. I think that's about right. Alright, first thing I would do before entering the room is check the patient's chart for a history of respiratory or heart conditions. Knock on the door, come in, fight for privacy, wash my hands, and introduce myself. Hello, Sydney. My name's Erica, and I'll be your nurse today. Can you state your full name and birthday, please?
Sydney Wiederman, 11/15/97.
Great. Can you tell me why you're here?
A heart and lung exam.
Good. And do you know where you are?
McLaren.
And do you know the date?
It is October 4th.
Okay, great. Patient is ANO times 4. She is alert and orientated to person, place, time, and situation. So, first of all, we're going to just start by saying if during this assessment you feel any pain or you're uncomfortable in any way, I just want you to know, to let me know, because we don't want any of that. And are you in any pain currently?
No.
Okay, good. And how would you like for me to address you today?
Sydney's fine.
Okay, great. Start by asking you just some general questions about your health. Do you have any type of respiratory or heart disease, or have you ever had one?
No.
Been diagnosed with? Do you have a cough, chest pain, shortness of breath?
No.
COPD, CHF, eczema?
No.
Any history running in your family of any of those diseases?
No.
And do you ever have wake up with heart palpitations in the night or during the day? Have those?
No.
Shortness of breath upon exertion? That's out of the normal?
No.
And have you been in any accidents or had any traumatic injury or surgeries to your thoracic area or your heart area?
No.
Okay. Are you a smoker?
No.
And are you around people that smoke?
No.
At work or otherwise, are you environmentally around anything that could compromise your breathing?
No.
Okay. And do you perform breast exams?
Yes.
How often?
Maybe once a month.
Okay, good. Keep doing that. Upon just inspection and looking at Sydney's breathing, she is equally rising and falling when she breathes on both sides of her thoracic cavity. She doesn't have any heaving or lifting of the mediasternum line. She isn't out of breath. She's rhythmic in her breathing and not having any issues at the moment. Also, her sternal angle is less than 90 degrees, so that is normal. She doesn't have any cyanosis or discoloration. Her temperature is good, and it doesn't feel too hot or too cold. It feels like a normal temperature. It's not clammy. Her skin looks to have no lesions, lumps, and I would also have her in a gown, and I would be looking underneath of her clothing if this was a real clinical situation. But for today's video and for the auscultating, we're also just going to have her stay clothed. And I will do it over her clothing, but in a normal situation, I would most definitely make sure that that was skin to skin. Okay, first I'm going to do a couple of tests. We're going to do what's called a tactile phlebitis test. Just going to have you say 99 for me.
99. 99. 99. 99. 99. 99. 99. 99.
Okay. I could feel there were palpable vibrations when she said the word 99. I'm going to check for crepitus, which is subcutaneous bubbles, air sacs under the skin. She has nothing of the sort. Going to percuss, start at the apex, subclavicular line, right above clavicle. Oh, sorry. Sounds are radiant and resonant, and when you get by the liver and the pericardium, it's a little bit duller there. It's kind of like a thud. All right, Sydney. Listen to your lungs. I'd like you to take a full deep breath in and out when I put my stethoscope on. There was no adventitious lung sounds, no cracking, wheezing, or rhonchi present. Everything sounded very normal over all of the intercostal spaces. That's where you want to make sure that you check is the lung field for the intercostal spaces and not the ribs. All right, I'm going to do the same thing to posteriorly to your back area of your lung field. Okay, upon inspection, there you would also look for any lesions, any sign of discoloration. Temperature, everything looks fine. Her AP diameter, we'll check that real quick. There's a 1-to-2 ratio that is completely normal. Actually, check right about here. Could you take a deep breath for me in? Good. She's symmetrically expanding her lungs, which is normal, and filling up her lungs, and so it is expanding and coming together just like it's supposed to. We're going to also do tactile fermentus in the back. Could you say 99, please?
99, 99, 99, 99, 99, 99.
Great, thank you. You can feel the vibration up here, very strong. Scapula area is very diminished. You can barely hear it actually, or feel it, excuse me. Barely feel the vibration. And then down here, it is weak as well, and that is equal bilaterally on both sides felt. I'm going to percuss. All areas of the lung field. And those are resonant throughout. Okay, Sydney, let's see. I'm gonna check for crepitus. Just trying to feel for bubbles, pockets of air underneath the subcutaneous layer of skin, and she does not have any. Just gonna have you take a deep breath once you feel my stethoscope in and out, total. Thank you. No advantageous sounds in the back as well as in the front, and so therefore no rhonchi, wheezing, and everything sounded equal, and you were breathing and heaving at a normal rate. Okay, Sydney, I'll have you lay back down for me. This time I'm going to check for jugular vein distension. I'm gonna lay her down flat, bring her up to a 45-degree angle, and watch that jugular vein and see if we have any changes in that area. And she has no GVD. Are you comfortable right there?
Yep.
Okay. I'm gonna check for her carotid artery. There's no thrills. Always do one side at a time. Also take for bruise. Pulse is equal by lat inner carotid artery and at a +2 strength. I'm going to check some more pulses on her extremities. Start with her bronchial pulse. I'll do the side 2. Equal by lat +2. Check her radial pulses. Equal by lat +2. I would check her femoral pulse, skin to skin, if she had a gown on, and that is right in the crease of your body right there in your legs. Popliteal pulse. Equal by lat +2. Her posterior tibialis. Just posterior to your ankle bone, near dorsalis pedis. You follow the big toe down kind of the midline of your foot. You can go ahead and feel that. All of our pulses were equal by lat +2. I check for edema. Inspect the skin, especially the legs, for any cyanosis, any discolorations, which could mean dehydration. Oh, you can't really see this. Oh, I guess it doesn't matter. Here, put your foot up here. Cap refill. And that is less than 3-second refill time on her toes. Everything on her skin looks good. There's no discoloration. Have you had any problems feeling your feet? Any numbness? Any
No.
weakness in your legs?
No.
Do you get restless legs at night? No soreness? Okay, good. Check the arms exactly the same as the legs. I'm going to check for cap refill time. I'm going to look for pitting edema. She has absolutely no edema in her extremities, and her refill time is coming back -3 seconds. No lesions, no discoloration as well. And her edema then would be a 0 because she doesn't have any. So never had any issues with like your sodium levels or Had a doctor tell you your labs were not normal for that?
No.
Okay, good. All right, I think that we're ready to move to the heart. Do you mind if I sit on the bed with you?
Yeah, that's fine.
Okay. Okay. I'm gonna listen to some heart sounds. You don't need to hold your breath, but just try to do like some shallow breathing for me, okay? We're gonna start by finding some landmarks. And we're gonna want to start at the right side, second intercostal. Mid-sagittal line. Or aortic valve. Second intercostal on the left side. So pulmonate. Third intercostal, left side, inside Rhodes point. Down to the fourth intercostal is a tricuspid valve. And over in the fifth intercostal, a little bit of an angle from the last one, is her mitral valve. There was no adventitious sounds. Her S1 and S2 were clearly noted. They were easy to hear when I auscultated over all of her areas. And Sydney, is there anything else that you have questions about or that I can do for you today?
No.
Okay, thank you very much.